Welcome to Humanautic, unlocking the secrets inside your body and brain. There's a small organ inside your body, about the size of your little finger. You've likely never felt it, never needed it, and never thought about it until it explodes. This is your appendix. It's been called useless, forgotten. But when it turns on you, it can be deadly. In this episode of Humanautic, we explore the strange, controversial story of the appendix. What it is, why it's there, how it fails, and what happens when it's surgically removed. What even is the appendix? The human appendix is a narrow, tube-shaped pouch attached to the first part of the large intestine, the cecum. It's about 2 to 4 inches long. It's lined with immune tissue. And for decades, scientists thought it served no real purpose. In fact, Charles Darwin himself speculated that the appendix was a vestigial organ, left over from our plant-eating ancestors who used it to help digest cellulose-rich diets. In the early 1900s, appendectomies, surgical removals, became common. And people lived just fine without them. This seemed to confirm its uselessness. But modern science is rethinking that. Recent research suggests the appendix may act as a safe house for beneficial gut bacteria, a place where healthy microbes can hide during a severe illness, like diarrhea or cholera, and repopulate the gut once the storm is over. So, maybe not useless after all. But definitely not essential either. What is appendicitis? So how does this little tube go from harmless to deadly? Appendicitis is inflammation of the appendix. It usually starts when the opening to the appendix becomes blocked. Causes of blockage: hardened stool, called a fecalith; enlarged lymphoid tissue; parasites; tumors; trauma. Once blocked, bacteria trapped inside multiply fast. Pressure builds. The tissue becomes inflamed and swollen. And without quick intervention, the walls of the appendix begin to die from lack of blood supply. Eventually, the appendix may rupture, releasing infected material into the abdominal cavity. This is called peritonitis, a severe, potentially fatal infection of the abdomen. This condition kills thousands each year, especially in places without access to quick medical care. The symptoms. How do you know if your appendix is turning against you? Most people first notice a dull pain around the belly button. Over a few hours, that pain shifts to the lower right side of the abdomen. Classic symptoms include sharp or cramping abdominal pain, loss of appetite, fever, nausea or vomiting, abdominal swelling, rebound tenderness, pain when releasing pressure, inability to pass gas. Appendicitis symptoms usually develop rapidly, often within 24 to 72 hours. And once they start, the clock is ticking. Doctors often say, if you can jump, it's probably not appendicitis. That's because the pain becomes unbearable with any movement, coughing, or pressure. Diagnosis. If you show up at an emergency room with suspected appendicitis, doctors will act fast. They may perform a physical abdominal exam, blood tests, checking white blood cell count, urinalysis, to rule out kidney stones or UTI, ultrasound, CT scan, most reliable for visual confirmation. On a CT scan, an inflamed appendix will appear swollen, fluid-filled, and sometimes surrounded by pus. Once diagnosed, treatment usually starts immediately, because time is the biggest enemy. Treatment and surgery. The standard treatment for appendicitis is surgery, called an appendectomy. Two main types: laparoscopic appendectomy, small incisions, quick recovery, less pain. Open appendectomy, for ruptured cases, requires a larger cut and longer healing. During surgery, the appendix is removed, and the area is cleaned to prevent infection. If it has already burst, patients are given strong intravenous antibiotics and may require drainage tubes to remove infected fluid. Recovery timeline. Laparoscopic, 1 to 2 weeks. Open, 2 to 4 weeks. Rupture, up to 6 weeks, with hospital stay. Appendectomy is one of the most common emergency surgeries worldwide, and one of the safest, when performed early. What happens if you do nothing? Untreated appendicitis is extremely dangerous. Within 48 to 72 hours of onset, there's a high risk of rupture. Once it ruptures, bacteria spread freely in the abdominal cavity. This leads to peritonitis or sepsis, a life-threatening condition where infection overwhelms the body. The fatality rate for untreated ruptured appendicitis can be as high as 30% in developing countries. Bottom line: if you think it's appendicitis, don't wait. Go to the ER. Life without an appendix. So what happens after the appendix is gone? For most people, nothing changes. You don't need it to survive, and there are no major long-term effects. Some studies suggest a slightly higher risk of infections after gut illness, but nothing serious or common. It's one of the few organs you can remove preventatively without impacting your life. It's small. It's silent. And it can turn lethal in just a day or two. The appendix might not do much, but ignoring it could cost you your life. Subscribe to Humanautic for more stories from inside the human body, and stay curious.